Deep in the heart of the Silesian region of southwest Poland is the village of Bolesławice. 30-year-old Asia Nosowska lives here with her family. She is almost totally blind, having lost her left eye. And with her right eye so badly damaged, it's taped shut for protection. She has limited control over her facial muscles, using her hand to help chew food. But this is Asia's new face. As just 15 months ago, her old face was grossly distorted and covered in tumors. In an extraordinary 24-hour operation, Asia had a face transplant.
Gdyby nie istniała możliwość przeszczepu, parę lat prawdopodobnie samodzielnie oddychać, a nie jeść.
Asia was born with neurofibromatosis type 1, a genetic condition that causes benign tumors to form along nerves in different parts of the body. In Asia's case, the tumors were mainly on her face and neck.
Jak guzy się powiększały, to nie było tak, że ten guz się powiększył w tydzień. One się powiększały przez lata. Więc człowiek się do pewnych rzeczy przyzwyczaja.
Throughout her childhood, as tumors grew, Asia's face was slowly distorting.
Ja nawet sobie nie przypominam, żeby Asia kiedykolwiek się pytało: mamo, dlaczego ja tak wyglądam, a nie inaczej.
Tutaj nasi wszyscy znajomi z wioski, bo wioska jest dość mała. Wszyscy się tutaj przyjaźniliśmy i nikt na to nie zwracał uwagi. Tu Asia zawsze była taka, zawsze ją traktowaliśmy na równi. Czyli nie było tak, że ona jest inna. To była moja siostra, zawsze.
There is no cure for neurofibromatosis type 1. The only medical answer is to have tumors surgically removed. Asia has had over 30 operations to remove tumors in the last 18 years. The face transplant was her 36th major operation. Carried out by Dr. Adam Maciejewski and his team, it was only the second ever face transplant to take place in Poland. Asia was chosen after several months of medical checks.
Her functional status was really significantly going worse. She wasn't able to eat, and her speech was also ununderstandable. Her breathing was also going worse. So we thought that she wouldn't be able to live with the progression of the tumor.
Incredibly for Asia, less than 1 month after being placed on the transplant register, a donor was found.
We have to match not only this histological, biochemical blood issues, but also the morphology of the face, the gender, the age, the height, the weight, and the type of the face.
Nieraz ktoś się pyta, jak to jest, ktoś musi umrzeć, i to są takie emocje, że ktoś, kto leży w szpitalu i czeka na serce, na nerkę, na inny narząd do przeszczepu, on nie czeka na śmierć drugiej osoby.
Chociaż w pierwszym momencie też radość, później trochę lęk, strach, ale wiedziałam, że to jest jedyne wyjście.
Face transplants are incredibly long, complex operations. Although clinically dead, the donor's heart is kept working to ensure a good blood supply to the face. Then, simultaneous surgeries take place in adjoining operating theaters.
On the donor, the face harvesting was done. Just the soft tissues, special muscles, nerves, and vascular structures. And it was like 80% of the surface of the head and neck.
As the facial tissues were being removed from the donor, a similar procedure was taking place on Asia. with the added difficulty of removing the tumors that had taken over her face.
The neurofibromatosis is quite dangerous because of very high and unpredictable vascularity, and the bleeding is enormous, and that's probably the most dangerous part of whole procedure.
During surgery, the bleeding was so excessive that 63 pints of blood were transfused to keep Asia alive. With fears that she wouldn't survive any more blood loss, the operation was stopped before all the tumors or lesions inside her mouth were removed. It had taken 9 surgeons, 6 anesthesiologists, and a team of nurses 24 hours to give Asia her new face.
Pierwsze moje słowa było do męża: zobacz, jak ona jest podobna do Dorotki, do młodszej córki. I no, oczywiście łzy szczęścia.
Łzy po prostu nachodzą do oczu, bo to jest wspaniałe wspomnienie. Mówię, jak moja siostra jeszcze po przeszczepie od innej dziewczyny i jest podobna do mnie. Ja mówię, jak to jest możliwe w ogóle?
It's now 15 months since Asia received her new face. No new tumors have developed, but there are still old tumors to remove and corrective surgery to be carried out. So Asia is on her way back to the hospital. 15 months ago, Asia Nosowska was the first woman in Poland to have a full face transplant. Born with the congenital disorder neurofibromatosis type 1, tumors had grown along the nerves in her face and neck and were threatening her ability to breathe. The face transplant surgery lasted 24 hours, but excessive bleeding from the vascular tumors meant the operation was stopped before all the smaller tumors could be removed. Asia spent several months in hospital, recovering from the operation.
Asia musiała się na nowo uczyć łykać, uczyć mówić, pić szczykawką, bo inaczej nie dało rady, bo nie działały nerwy, nie działały mięśnie twarzy.
Asia has never seen her new face because the tumors destroyed her left eye and badly damaged her right eye. But she has spent the last 12 months building her physical strength in order to cope with the second operation to complete the work.
Wiedziałam, że jeszcze trochę, że jestem twarda. Zresztą wiedziałam, że mam starcie wśród rodziców i to mi dawało dużo siły.
Żeby utrzymywać formę, musi mieć dużo siły, musi pracować nad mięśniami twarzy, nad mięśniami powięzi tutaj, ćwiczyć te, żeby rozciągać, to było po operacji naruszone. Utrzymywanie ogólnej kondycji takiej dobrej zawsze służy dobremu samopoczuciu i fizycznie i psychicznie.
It's been a year since the face transplant, and Asia is now on her way to the hospital in the nearby city of Gliwice. Her surgeon, Dr. Maciejewski, plans to remove the remaining neurofibroma tumors and carry out essential correctional work.
This procedure will improve her functionality, I mean the teeth status, the eating and lip movement, and also will improve a lot her cosmetic appearance, especially in the middle and upper part of her face.
Mam nadzieję, że ta operacja pomoże mi jeszcze w lepszej mowie. No i jestem pełna nadziei, że w końcu będzie lepiej.
Despite the fact that Asia has had so many major operations, seeing their daughter back on the operating table is still difficult for her parents.
Oczywiście zdenerwowani mocno, duża gula w żołądku, ale to nie pokazujemy tego Asi, żeby nie udzielał się, nie pogłębiał stres. Wiadomo, że na pewno też przeżywa i jakoś tam wewnętrznie.
Bo Asia jest bardzo drobną osobą, no i ta jej choroba zasadnicza, zawsze się boimy, że coś się tam może po drodze stać.
There are so many complex aspects involved in this operation that Asia will be under sedation for several hours. The first team of surgeons is led by Dr. Maciejewski. First, they have to lift off the skin of Asia's new face in order to realign her bone structure. The second team move in and set to work on correcting Asia's teeth and lower jaw. Both have been destroyed over the years by her aggressive facial tumors. After several hours in surgery, the work is complete, and Dr. Maciejewski is confident.
It's medicine, so we have to believe that everything will go well, but it's always some potential risk of this procedure, so we have to wait for a day or two.
Junia!
Hello.
Jak się czujesz? O Jezu, kosmonauto ty mój. Pełnili, wiesz co ci robili? No masz tak, masz nowe czoło, nowy nos, podciągnięty ten nosek, bo on trochę zleciał. Masz uzupełnioną tą skroń lewą silikonem. Ten policzek ci też wyciągnął.
No guzów nie ma.
Guzów nie masz, wiesz?
Asia has a long road to recovery ahead of her. She is highly susceptible to infection and still has neurofibromatosis type 1. There's no telling when or if new tumors may appear, or what part of the body they will affect. Just 1 month later, Asia is home. Through daily exercises, she's now able to eat and drink, but she still can't see, as her right eye remains taped shut. She now has about 30% vision and hopes that soon she'll be able to see her new face.